Hello students, today's topic is fetal circulation. Fetal circulation is a very important topic from embryological as well as pathological point of view because a lot of questions and MCQs come from this topic. Fetal circulation is quite different from the postnatal circulation because fetus lungs are not functional. So they obtain the oxygen and nutrient from the placenta, from the mother through placenta and umbilical cord. So actually the placenta acts as a respiratory center as well as source of filtration for the fetus. After the birth, the advent of breathing and the severance of umbilical cord that brings various neuroendocrine changes that transforms the fetal or prenatal circulation into postnatal circulation. So starting our topic, I would like to explain it through a diagram image because I think the diagram or the image memory or the video memory is much better and for a long term as well. This is the umbilical cord. It's attached to the placenta, and the placenta is attached to the womb of mother. As you already know that umbilical cord has one vein and two arteries. So this is the umbilical vein shown in red color because it contains oxygenated blood, and the arteries are shown in bluish color. The oxygenated blood enters through the umbilical vein to the liver. Some of it enters the inferior border of liver to the liver proper, and less than third of it enters the ductus venosus and then to the inferior vena cava. Ductus venosus is a connection between the umbilical vein and the inferior vena cava. So blood is shunted from the semi-functional liver to the inferior vena cava. The blood then from the inferior vena cava it enters the right atrium. In between the right and left atrium there is an opening which is called foramen ovale. So the oxygenated blood enters from the right atrium to the left atrium. From the left atrium it enters the left ventricle, and from the left ventricle it enters the aorta, and through the aorta to the through umbilical arteries it is returned back to the placenta containing the deoxygenated blood, the carbon dioxide and the waste. But some of the blood may not enter through this right atrium to the left atrium, but instead it enters the pulmonary artery, and from the pulmonary artery to the aorta through this ductus arteriosus, which is a connection between the pulmonary artery and the aorta, shunting the blood away from the pulmonary circulation. The mixed blood enters the head and neck region, and some of it then returns back through the aorta to the placenta. This was all about the placenta fetal circulation. There are three shunts. The first one is the ductus venosus, to which the blood is shunted away from the semi-functional liver to the inferior vena cava. Foramen ovale is another shunt through which the blood is shunted from the right atrium to the left atrium, and then there is a shunt which is the ductus arteriosus, through which the blood is shunted from the pulmonary artery to the aorta. After the birth, these three connections they close. They close because of the decrease in the pulmonary vasculature resistance, causing increase in the left atrial pressure, which causes this connection, and then the remnant is called fossa ovalis. Also, due to increase in the oxygen, there is a decrease in the prostaglandin level, and the ductus arteriosus also closes. But if it happens that these connections don't close, then they may produce different pathologies. Like if this foramen ovale doesn't close, then there is the connection between the right and left atrium, to which there is a mixing of blood, and it is a congenital heart defect, which we call ASD, or atrial septal defect. If the connection or the ductus arteriosus is not closed after birth, then the heart defect is called ductus arteriosus, which is also an acyanotic heart disease. And if the ductus venosus doesn't close, then what happens, that the blood is bypassed from the liver to the inferior vena cava, due to which a lot of toxins and waste, toxic materials, they are not removed from the body. They are not detoxified, so it starts accumulating in the body, causing different problems, like the child may have hepatic incapacity or seizures, etc. So these connections are normally closed after birth, but if they don't close, then they produce anomalies. Guys, if you like my video, please like, comment, share it with your friends, and thanks for watching.